Hello, and welcome to part 2 of Disability Awareness Specific Learning Difficulties. My name is Jane Warren, a specialist dyslexia practitioner at the University of Southampton. This is the second of 2 sessions which is aimed at raising your awareness of how to support students with dyslexia and other specific learning difficulties. The first session provided an overview of dyslexia, dyspraxia, dyscalculia, and attention deficit disorder, and if you haven't already viewed that presentation, it might be useful to do so first. This session focuses specifically on the types of difficulty that someone with dyslexia might experience and how you, as a mentor, can help them. There are 2 aims of the session. The first is to consider the impact of dyslexia on a student and the specific difficulties that it may present for them, and the second is to look at strategies that can be used by you as a mentor to support the student in the practice setting. If you've watched the first presentation, you will know that every student with dyslexia is unique and will present with their own personal set of difficulties. That means that what may work for one student may not work for another, and this is beautifully illustrated in the video clip you are about to listen to, where Lee talks about how her mentor thought she knew all about dyslexia because she'd had a previous dyslexic student, but how his difficulties had been subtly different.
If I tell my mentors I have dyslexia, I get a mixed reaction. Some people have grown up with a family member with dyslexia. Other people are different. It's a spectrum. For instance, my mentor could have somebody else with dyslexia, but I could be different. It's good to talk to people and find out what techniques people use compared to what I use. People have different opinions of people with dyslexia. Some of my friends with dyslexia don't pick up things very fast, whereas I'll pick them up faster. It's more of visual learning is better for me. Like, if somebody's given me a bit of paper with instructions on it, by the time I get to where I'm meant to be doing my task, I may have forgotten everything apart from the first line. But if I'm taught it visually, I'll learn it and be able to do it. It may take time, and my mentors may have to wait and let me do it a few times, but eventually I'll get it and I'll be able to perform it perfectly.
Although students will have their own areas of difficulty, there are common aspects, and the following slides will look at each of these in turn and give you some suggestions of what support may be beneficial. If we start off by looking at memory and organisational difficulties, a lot of these are attributable to the problems with working memory, which is very common in students with dyslexia. Working memory is the area of your memory that holds information in the short term while it is being processed. It's a bit like RAM on the computer. Like RAM, working memory can potentially become overloaded if you ask it to do too much at once. In terms of memory and organisational difficulties, students with dyslexia often find it harder and find it takes longer to fix information into their long-term memory. This may include unfamiliar terminology, such as drug names and medical conditions, as well as a tendency to forget phone messages. They may experience memory overload if faced with too much information too quickly, and that is a particular problem if there are a lot of distractions caused by noise and general busyness, such as they would experience in a clinical environment. Students may also find it difficult to transfer learning into a new setting, for example to apply theory to practice, or use previous knowledge from one ward in a new setting. They may have perfected a technique on a medical ward, but when they move to a surgical setting they actually need to relearn a lot of the information. Finally, dyslexic students may have problems with time management and organisation of their workload. In particular, they may find it difficult to follow instructions or to select information to pass on to others. So, for example, if they take a phone message, pulling out the most important pieces of information to hand on to somebody may be particularly challenging for a student with dyslexia. They may have problems sequencing tasks and remembering in what order they need to be done. Although that's not always a difficulty, in techniques such as moving and handling there are certain sequences that need to be followed from a health and safety perspective, and it is really important that students remember. They may have problems planning their workload and prioritising, and as we've already seen by looking at working memory, they may have problems in multitasking. So how can you help? You could sit down with a student at the beginning of a placement and help them devise a plan for the placement, highlighting key dates, looking at targets, setting clear measurable learning outcomes for them to achieve, and ideally mapping those against the time frame of the placement. You can give students extra time when they are actually completing tasks that will help them be able to organise their work and actually work out what is the most important thing to do at that time. You may need to be prepared to explain things more than once, and ideally don't give them too many instructions all in one go. Finally, if you can give them written instructions or provide a flowchart or something for them to look at, or encourage them to write their own down, that can be quite useful. The following clip features Katrina explaining how she has actually done this and how helpful she finds it.
It took me a long time to learn my left from my right hand side. If someone was to give me a simple instruction of go to the stock cupboard and pick something off on the right hand side from the top shelf, by the time I'd got there, I would have forgotten which side, what shelf and what I'm even looking for. That's why I need to write it down now. And even sometimes I need to use my hand still to know my left from my right.
We now move on to look at reading difficulties. Although a lot of people would recognise this as being an area of difficulty in dyslexia, they don't always realise the specific aspects of reading that are affected. Students with dyslexia often feel embarrassed reading aloud, and this is due to their inability or difficulty with sounding out words and pronouncing them correctly. We'll look at that a little bit later when we talk about language difficulties. They may misread unfamiliar words and have difficulty skim reading. They are usually slower readers and need to reread things several times to get the full meaning. Reading charts in clinical practice is quite difficult because there is a lot of information all presented on the same chart in different layers. We've already talked about the problems a student may have due to background noise. In a clinical area, this may make it very difficult for students to concentrate on what they need to read. Some students with dyslexia have visual perceptual difficulties, known as visual stress or Erland syndrome. They may find that the text is distorted, or it feels as if the words are jumping around as they are trying to read, especially with black print on white paper. Finally, students with dyslexia often have problems understanding medical and pharmacological language, particularly words that look or sound very similar, which can be a particular problem when it comes to reading drug names on drug charts. In terms of how you can help, you can allow them extra time for reading and provide opportunities to discuss what they have read so that you can check out that they have fully understood it. If possible, provide information in a dyslexia-friendly format. Students with dyslexia will find it quite difficult to read a page of dense text. They do appreciate things being split into short paragraphs or bullet points where possible. They may also prefer things to be presented on cream paper, although some students will have coloured overlays provided. Some students also find certain sizes and types of font easier to read than others. Another way you can help a student with reading is to use coloured highlighters to identify key points that they may want to go back and revisit. The next area to consider is writing and spelling difficulties. Some students have problems with legibility, although sometimes this is a deliberate ploy to hide their inability to spell. They may find it difficult to write in appropriate professional language or to write concisely. Students with dyslexia are often identified as being more articulate orally than they are on paper. They may have problems writing accurately. They often have not developed automaticity in their skills, and learning spelling rules is a classic example of this. Writing under time pressure will exacerbate any problems they have. Phonological processing, being able to break words down into their component sounds, is a key difficulty in dyslexia, so spelling technical terms is something that is quite difficult for dyslexic students. Filling in forms can also be challenging, so encouraging them to make a rough copy that you can check through before they write it into the notes is helpful with junior students. But remember that by the time they qualify, students have to be able to work independently. So this is something they need to find other strategies to help themselves with by the time they get into their final year. You could help students summarise using mind maps and spider diagrams. Notes don't have to be words. Allowing students to type notes, as more and more clinical areas are moving towards computerised records, and with typed notes it might well be that writing and spelling difficulties become less of a problem for students with dyslexia, provided they can use spell checkers and so on. Finally, the most important thing is to allow students sufficient time, and if possible a quiet, uninterrupted environment where they can actually write notes and other paperwork. Moving on to language difficulties. A small number of students may experience language difficulties and struggle to find the right word to say. They might find it difficult to give clear instructions, go off at tangents, and talk in a very disjointed way. They may use inappropriate intonation or volume of speech. You may sometimes notice that students seem to shout or be very loud with patients. Students may misinterpret what is being said to them. That can be linked to the understanding of written and spoken words, and students may frequently mispronounce unfamiliar words. In the following clip, Rosie talks about her problems and her anxieties in relation to pronouncing medical terminology and how she has overcome this.
I'm a third-year student nurse with dyslexia. At first, I thought my dyslexia was just about my reading speed, but it's actually about my pronunciation. When I get a new word, I have to keep saying it over and over again until I remember it. But if I don't say it for like a couple of weeks or months, then I'll forget it. The dictaphone's really helpful because I can just go to my mentors and get them to say a word, and then I can just go home and just replay it until I remember it. If you don't know the word, then you start using different words and it makes you sound less intelligent. So by learning the word, it really helps. In the handover, when you're doing it in front of 15 students or more, it's quite nervous, and you're scared to say the word in case you get it wrong, in case someone judges you. But I think if you just say, I don't know the word, then people are usually okay with it. But you have the odd person that's oh, can't believe she can't say that word. But if you just say, I'm dyslexic, most people try and help you as much as possible. I had this nurse once. I have my own learning ways I teach myself, and I laminated my table with a percentage chart to help me. And one of the nurses came up to me and said, that's cheating. But I just said, this is how I learn. I'm not stupid, I'm just dyslexic.
So how can you help? Like the mentor who helped Rosie, allowing students to record medical terminology on their digital voice recorder to practice pronunciation, with, if possible, you pronouncing it for them. If you provide a checklist of key terms specific to your clinical area, and give this to students before the placement starts, it gives them a chance to start to become more familiar with the words. Finally, do give clear instructions. We've already talked about allowing students to write things down where they feel it helps. In terms of motor skill difficulties, some students have difficulty with left and right coordination and have problems following a sequence, such as wound dressing. I talked earlier about automaticity, and it's problems with automaticity that cause students to have difficulty in remembering a sequence of events. It is not always crucial, but some things, such as basic life support, really won't work unless the student gets the head in the right position at the beginning of the sequence. Similarly, in a moving and handling procedure, it is really important that they check the brakes are on the bed before they move on to the main procedure. In terms of how you can help, you may need to demonstrate skills to dyslexic students more than once. We often work on a principle of see one, do one, and then get on with it. But students with dyslexia may need to watch things over and over again before they even feel confident having a go. It is then about providing the student with sufficient supervised practice until they feel secure. If you write a flowchart, or get the student to compose a flowchart, which details the correct sequence, it gives them something to look back on and look at as an aide-memoire. You can see that a lot of the general principles that will help students with a learning difference are actually the principles of good support for all students. When planning support, remember that there is a need to achieve a balance between support and independence, and that strategies learnt in an academic setting don't always translate well to practice. Students have varying levels of self-awareness, and one of the things we aim to teach them when we look at supporting students with a learning difference in a university setting is something called metacognition. This is about learning how you learn, recognising the areas you struggle with, and looking at strategies to help you overcome them. Students with dyslexia, however, often lack confidence and experience an ever-present fear of failure. Almost half of the students with dyslexia at university have been diagnosed in their time at university. And this means not only that they may have experienced failure prior to diagnosis, but also that they may not have had time to develop the success strategies that they need. The following clip features Ewan, who has attention deficit disorder, talking about the impact that some of this had on him at an early age and how he struggled as he has progressed through his nursing career to overcome some of the difficulties.
I'm a third-year nursing student with attention deficit disorder. I've always had trouble concentrating, but you never know how much or how easily you're being distracted. Always had massive confidence issues as well, because I was the only one being told off. It's not going to be a problem when I qualify, it's just something I need to know whether I should do something about it now. I always find myself asking the mentors to set rigorous guidelines of what I can and can't do. It all started with my first 2 placements. The first placement was great, I was really encouraged, and then I got knocked back by the second placement. They told me I was too confident, learning to run before I could walk. Now I'm really careful not to overstep my bounds and upset my mentor, but this means I find myself not capable of showing what I'm capable of. But if my mentor understood, then they'd be able to set boundaries and let me know how much freedom I had. I'm at my best when I'm kept busy, when my head's full of stuff. I like it when I get to ask a question and the mentor helps me find out the answer. I don't want to just do an ECG. I want to learn about the heart. I need to be kept busy because I get sleepy when I'm not. I need a long list of jobs to do that I can do when I get a gap, like empty catheter bags or something. I like lists. In handover, when you get the handover sheet, I like that, just 1 page. I use highlighters and draw boxes for things like washes to remind me to go back to do them later. It helps me to prioritise if I can see everything visually.
Students benefit from clear policies of inclusivity where they feel supported to disclose their learning difference. If you can give them information prior to the placement, it allows them time to prepare. That means that they can identify their individual learning needs and discuss those with you, and together you can set clear and measurable outcomes. Students may benefit from a learning contract. But the most important thing is to make sure that you work together with the student to devise strategies and help them to succeed. In conclusion, as the name suggests, the key feature of learning differences is that the individuals affected have a different way of thinking and learn differently. Students with any of these difficulties have the potential to succeed and achieve the same goals as their peers, and this has been demonstrated in research studies over the years. What the research has also shown is that they will have worked considerably harder to do so. The key to their success is to develop a range of strategies which they can use to overcome their own personal set of difficulties. You can help them to do this, and hopefully this presentation has given you some ideas.